Morning, we're taking a closer look at a condition affecting women all over the world, including right here in East Tennessee.
I was so ashamed that I had this, and the only thing my doctor told me was you need to lose weight and we're going to put you on birth control.
Chronic pain, extreme fatigue, and excess weight gain. All of these are symptoms of polycystic ovary syndrome. The World Health Organization calls PCOS a significant public health problem. It affects nearly 13% of reproductive-aged women, yet 70% of them remain undiagnosed, leaving many feeling frustrated and confused about how to manage this lifelong condition.
The morning routine has become a ritual for Kat Steele.
I use spearmint tea, which is really good for inflammation.
She packs meals for the workday and lots of vitamins to help regulate her hormones.
I have to be really mindful of things that do cause inflammation in my body because that can lead to a lot of really negative symptoms.
At 28, managing those symptoms has been a struggle since she was first diagnosed as a teenager with polycystic ovary syndrome, also known as PCOS.
I would be in so much pain during my cycle that there were days I missed school. I would be doubled over in bed. I could barely walk.
An ultrasound found cysts on her ovaries, and blood work revealed high levels of testosterone. Doctors tried 11 different contraceptives and medication to regulate her insulin.
Within a year and a half, I had gained 120 pounds. I had dealt with mental health issues, and then all of a sudden my hormones were shredded.
PCOS affects women during the reproductive years, but symptoms among patients vary, including irregular periods, excess facial and body hair, severe acne, and enlarged ovaries, which in some cases can cause infertility. Signs are typically more severe in women with obesity. Those with a family history or type 2 diabetes are at higher risk for PCOS. But doctors don't know exactly what causes it, and more women like Steele are scouring the internet looking for answers.
This morning I had 2 or 3 patients with it.
Dr. Allison Eaton with UT Medical Center says physicians have differing opinions on how to manage PCOS because there's no one-size-fits-all solution. But leaving it unmanaged can lead to an increased risk of developing uterine cancer, heart disease, or diabetes.
Weight management definitely can help, and you don't have to get to a normal BMI. Just losing 5 to 10% of your body weight can make a big difference metabolically, and it can lower your insulin resistance. Having
PCOS for a lot of people makes it much harder to lose weight because of the metabolism issues that you carry. So for me, that resulted in having weight loss surgery.
Steele has found a doctor who's helping her navigate solutions that are working.
I feel great. I've lost 70 pounds in the last 4 months.
In May, she gave a commencement speech at her graduation from the University of Tennessee.
We did it.
A milestone she's proud of, and she's feeling better than ever.
Getting to a healthier space overall is really my goal right now so that I can just do all the things I want to do in the future.
Now, Dr. Eaton says to help manage PCOS, decrease your estrogen exposure. Heat things up in glass instead of plastic. Make sure to get good sleep. Maybe consider a sleep study if necessary. Get active and consider using contraception. Now, Kat says another thing that has really been a game changer for her is seeing a therapist for her mental health. She says it helps manage her stress. It keeps her cortisol levels in check, which helps regulate her overall health.
My goodness, this is so debilitating for some women.
Well, and there's a lot of people dealing with it out there.
I know. I'm glad she shared her story because I think showing too the positive changes she's made,
Yes.
how she's been able to cope has been pretty amazing.
Yeah, it's really helping her. And we have more resources right now on PCOS at WBIR.com.